Mr. President, the faces and voices of the opioid and heroin epidemic are all around us. The victims and survivors are everywhere in Connecticut and across the country just this past weekend. One of them perished. A young woman, Erica Lynn Hughes, found unconscious in her boyfriend's apartment, later dying from a heroin overdose. Erica was only 21 years old, her whole life ahead of her, and a future destroyed as a result of this epidemic. And her family, bravely and strongly, has chosen to speak out and stand up in the midst of their shock and grief to say that they hope that Erica's story will inspire action to combat this epidemic of overdose and addiction. Rampant opioid overdose and abuse and misuse in our country has reached epidemic proportions, and it shows no signs of slowing. In Connecticut, I've seen these stories firsthand, how this public health hurricane has swept our state and our nation, crashing down on the lives of families and innocent people, much as a natural disaster would destroy homes or landscape, leaving a path of pain, heartbreak, and addiction in its wake. The numbers in Connecticut are as shocking as they are tragic. Last year, in my state, a record number of people, nearly 700, died from opioid overdoses. Sadly, this number is abstract, but it reflects a disheartening trend that has led to a 75% increase in prescription drug overdoses in Connecticut since 2012. And I've seen these stories and faces and voices firsthand in roundtables that I conducted around the state of Connecticut, 9 in all, involving public health experts, doctors, specialists, public officials, law enforcement, and maybe most movingly and profoundly, recovering addicts and their families. I heard from parents who have buried children far too young. I heard from first responders whose quick actions saved lives using Narcan. I heard from doctors who understand that change is needed to prevent this disease from spreading further, and from families and professionals in Torrington and Rocky Hill, Willimantic and Wethersfield, Bridgeport and London, New Britain and New Haven, across our state, people who came forth to break the silence and defeat the denial that is one of our greatest enemies in this fight against opioid addiction and dispute. This problem knows no boundaries, no distinctions in income, race, religion, zip code. It afflicts and affects everyone, everywhere. And that is the beginning truth to solve the problem. I heard heartbreaking stories from a woman who lost both of her sons to addiction. The sobering conversations I had with her family and others, while not always easy, were absolutely crucial to my understanding how widespread and pervasive this problem is. What I heard from them and what I believe is necessary is a call to action. It is more than an effort to honor their legacy, the legacy of Connecticut citizens we lost last year, mothers and fathers, daughters and sons, citizens, sisters and brothers, but to teach every one of us how we can reach and assist those who are still fighting their own private battles against this disease. And make no mistake, it is a disease. It is every bit a disease as much as any that we discuss on this floor as requiring research and action and urgent and drastic steps that we can and must provide, because it is demeaning and reducing our nation's fabric. It goes to the core of America. These conversations led me to do a report, and I was inspired by the loved ones and families who have lost the most. They've lost members of their family, to do a call to action. And it's called Opioid Addiction, a Call to Action, which has specific and definite recommendations, 23 of them, some requiring funding, but others without fiscal impacts. And in a series of speeches on the floor, I hope to discuss them at length, not leave this issue at one talk, one speech, one remark, but talk about it continuously, as we all should be doing in our communities. Because again, denial and silence are the enemies here. This report outlines 23 policy proposals focused on curing our nation's addiction to opioids. The proposals are all grassroots, community-based solutions suggested by people who have a firsthand knowledge. They are experts, maybe not in academic training, maybe without PhDs and qualifications based on formal study, but they know this pervasive problem. They've seen it firsthand. They have observed the wreckage and destruction that opioid addiction causes, and they cannot bring back the lives of their loved ones, but they are determined that others will be spared this hurricane's effects. Each of these proposals, which touch on prescribing practices, adequate treatment, emergency medical response, law enforcement, and help for our veterans, has the common goal of ending this crisis. They are a response to the most pressing issues I heard throughout our conversations. While none is a panacea, none is a single bullet, all of them together are the beginning of a long process that must be undertaken toward curbing this epidemic. A place to start is with our prescribing practices, which is where misuse and abuse so often begin. Our nation makes up 5% of the world's population. We use 80% of its opioid painkillers. In 2012, doctors wrote 259 million prescriptions for painkillers, enough for every American adult to have a bottle of these controlled substances for themselves. Everyone a bottle of painkillers in the United States. Now, many of us have children. My wife Cynthia and I have 4. Every one of them has played sports. Every one of them has suffered sports injuries. And most of them could have availed themselves of these painkillers. We drew the line and said, no. Other parents should be doing the same, but more important, the providers should be exercising greater discipline and self-restraint. Because every one of those bottles, even if prescribed for legitimate injuries, broken bones, repaired LCL, other kinds of injuries, are potentially a risk. Just last week, a couple in Connecticut were arrested for selling painkillers out of their home. For 2 years, they collected 1,400 powerful painkillers from their local pharmacy, abusing their own prescriptions in the process. In the pharmacy visit that got them arrested, the couple picked up 300 oxycodone and 140 oxymorphone tablets. This flagrant misuse of the system cannot and should not be possible in our state or any other. There are legitimate reasons for painkillers to be prescribed, especially in case of chronic pain or end-of-life situation. There's no need to deprive people of those painkillers when they need them for those inevitable reasons. But my call to action outlines steps to confront this issue where it can be addressed so as to minimize the risk of abuse or misuse or overuse, especially when young people are involved, such as our children. It would mandate training for medical professionals to reduce opioid overprescribing. It would call for Drug Enforcement Agency guidelines for partial fill of opioids, meaning fewer of these deadly drugs would make it onto our streets. Of course, reducing prescriptions can't be the only answer, particularly when so many who need care go without it. My report also seeks to improve treatment options, calling for meaningful mental health parity and implementation of the law requiring it, much more vigorous and effective enforcement to ensure that people who need help actually receive it. And this step includes access to medication-assisted therapy that can prove essential to the recovery process. We can do more to guarantee that naloxone, a powerful antidote to heroin overdoses, remains both affordable and accessible. This means holding manufacturers accountable when they begin raising prices to astronomical levels. The prices have been skyrocketing. Local police and firefighters are often unable to afford it in their current budgets. And it means also pushing for elimination of copays when it is prescribed at pharmacies. Insurance ought to cover it. It also means that the federal government must do our part and increase funding for Narcan so that cash-strapped first responders can actually afford it to save lives. Our law enforcement officials require both the training and resources needed to keep our streets safe and our communities healthy and drug-free. And that means funding to establish prescription drug monitoring programs, really effective programs to facilitate training so that police officers can recognize when suspected criminals are actually people struggling with addiction, and to assist drug take-back programs throughout our state and nation that allow the return of unused prescription drugs. Finally, in my role as ranking member on the Senate Veterans Affairs Committee, I have encouraged the establishment of more consistent and safe VA prescribing practices and the creation of an integrated service model for mental health and pain management. I am pleased that the Senate raised this issue and addressed it and passed the Comprehensive Addiction and Recovery Act earlier this year. But that measure is a down payment. It's only a beginning. I hope that policy levels at all ranges of government will draw on the strategies delineated in this legislation and in my report and elsewhere to combat the devastating epidemic of addiction and abuse. Passing new laws is not the only answer. Enforcement and implementation of existing ones is necessary too. And the prime example is on mental health care, where still, years after President Bush signed that measure in 2008, its implementation is inconsistent and inadequate, and enforcement of mental health parity remains an aspiration, not an action. Part of what we need to do is make sure that existing laws are implemented effectively and fairly, and that the investment is made in common sense, practical measures, like the 23 recommendations I've outlined in this report, by no means a sole or exclusive way to deal with this problem. I have no pride of authorship in these 23 recommendations. I would yield to wiser and better suggestion, but the point is, action is necessary. It's necessary now because every day we lose lives. Despite the best efforts of our first responders and our medical community, we continue to lose lives and futures, and our families continue the grief and heartbreak that I saw in my roundtables and that families in Connecticut feel today. I thank you, Mr. President. I yield the floor.